the return to driving component is important and not one that I think we think about a lot. Julianne Schmidt out of Georgia has done some great work with this, looking at asymptomatic individuals following concussion and matched controls. And even though they were asymptomatic, those who had a diagnosed concussion had poor driving performance, as well as correlations between driving performance and cognitive assessments. I think with driving, one of the things we need to consider is it's not just the potential for harm to the patient, but if they are on the road and they have impairments, they are a danger to others. And so we should really think about what we allow for driving. There are not a lot of good evidence-based recommendations that are out there, but clinicians should be discussing risks and harms with patients, perhaps considering language in your take-home instructions after discussing with your directing physician, and try and find a way to make this happen. This is a quality improvement initiative that was done in a sports medicine clinic where they were aiming to increase their driving recommendations to patients. First, they noted that it was only given to less than 10% of patients. So they did education of their providers and they were able to increase providing driving recommendations to 20% of patients. They gave patients some handouts and that increased it slightly more. But it wasn't until they actually made changes physically within their EMR system that required the clinicians to ask on the discharge if they provided driving recommendations, and they were able to actually get to 100% of patients receiving some type of recommendation about driving.